Hello students, today we are going to revise the topic psychiatric rehabilitation. So first I am going to tell you what is the meaning of rehabilitation. Rehabilitation is nothing but the action of restoring someone to health or normal life through training and therapy after imprisonment or after any illness or after any psychiatric hospitalization. So this was the meaning of rehabilitation. Now we are moving towards introduction. So rehabilitation is the process of enabling the individual to return to his highest possible level of functioning. It is an important component of the community mental health program and is undertaken at the level of tertiary prevention. We have discussed levels of prevention in psychiatry in the last class, primary, secondary and tertiary prevention. So this rehabilitation comes under tertiary prevention. Next, the definition. According to Maxwell Jones in 1952, he has given this definition of rehabilitation. Rehabilitation is an attempt to provide the best possible community role which will enable the patient to achieve the maximum range of activity, interest and of which he is capable of. Like, we can direct them, we can help them, we can advise them, we can assist them, we can support them, and we can give the answer for questions they have, right? So this is the definition of psychiatric rehabilitation. Next, we are moving towards which are the disorder needs a rehabilitation. So chronic schizophrenia, chronic organic mental disorder, mental retardation and alcohol and drug dependence. So these are the main disorders which needs rehabilitation. Next we are going to see principle of rehabilitation. What are the principles? So first one is primary focus is on improvement of capabilities and increase in independency level. We help them to improve their capabilities and their independence so that they can work by their own. It focuses on ability to function rather than developing good insight. Patient active participation is very essential in rehabilitation. Skill development, therapeutic environment are fundamental interventions for a successful rehabilitation process. And increasing independence would be the first step in rehabilitation process. So their skill development is very much important with therapeutic environment, and we can use the fundamental interventions to rehabilitate the person in the process. Next one is psychiatric rehabilitation approaches. What are the approaches? There are 4 approaches in that. First is psychoeducation. In psychoeducation includes diagnosing the problem, telling the person what to expect regarding illness and discussing treatment alternatives. It means we give education about the problem. Next one is working with families. When rehabilitation you are giving to a person, you need to work with family as well, right? So encouraging family members to get involved in treatment and rehabilitation program. We involve family members as well. Then group therapy. So in what we do in group therapy is positive aspects of group therapy includes an opportunity for ongoing contact with others, validation of their perceptions, sharing their views about problem and problem solving ability. So in group therapy, there are group people, those who are talking and sharing their views, their perceptions, their problems. Next one is Social skill training. Social skill training, it involves teaching specific living skills that the patient is expected to have in order to survive in the community. It means whenever patient is discharging from the hospital, so a patient or a person should have the skills so that he can live in the community area. Next one is rehabilitation team. Who are the members of rehabilitation team? Is professional contributing to psychiatric rehabilitation includes psychiatrist, clinical psychologist, psychiatric social worker, psychiatric nurse, occupational therapist, recreational therapist, counselor, and other mental health paraprofessionals. So these are the members who can work in rehabilitation team. Next, we are moving towards steps in psychiatric rehabilitation. What are the steps involved in psychiatric rehabilitation? So psychiatric rehabilitation begins with the comprehensive medical psychiatric diagnosis and functional assessment. These are key elements in identifying impairments and disabilities. So the first step is reduction of impairments. How we can reduce that impairment? This rehabilitation interventions with psychiatric patients require reduction or elimination of the symptoms and cognitive impairment that interferes with social and vocational performance. These impairments are reduced and eliminated for the greater part by various psychotropic agents. Next one is remediation of disabilities through skill training. Skill training is used to remediate disabilities in social, family, and vocational functioning. Patient generally requires training in self-care skills, interpersonal skills, vocational and employment pursuits, recreational and leisure skills. It means in remediation disabilities through skills, in that we teach them to how to take care of themselves, interpersonal skills, vocational skills, and employment pursuit, and recreational and leisure skills. How they need to behave. Third one is remediating disabilities through supportive interventions. When restoration of social and vocational functioning through skills training is limited by continuing deficits, rehabilitation strategies aim at helping the individual compensate for handicap by learning skills in living and working environments, adjusting the individual and family expectations to a level of functioning that is realistically attainable. It means in this we support the patient to cope up with the situation. Remediation of handicaps. In addition to clinical rehabilitation interventions, the disabled person can be helped to overcome their handicaps through social rehabilitation interventions, example, community support program. Next, we are going to see the types of rehabilitation. First one is social rehabilitation. So what is social rehabilitation? The client has to feel a sense of responsibility and adopt healthy roles and modify the deviant behavior with normal behavior. The preventive and curative measures will be adopted by the individual client who lead satisfactory and useful life in social environment. Opportunities have to be provided to the client to maintain the re-established social adequacy. Vocational rehabilitation. In this process, which enables persons with functional, psychological, development, cognitive, and emotional disabilities or impairments or health disabilities to overcome barriers to accessing, maintaining, or returning to employment or other useful occupation. In vocational rehabilitation, we teach a person the psychological development, cognitive and emotional, whatever disabilities they are having, in that they should improve. Why? So that they can return to their normal employment life and they can use their occupation in the future. Educational rehabilitation, in educating or giving training for a person with psychiatric disorder in specific area is essential, where the client meets the goal of treatment and rehabilitation, like for example, explaining the family about client's disease condition and its prognosis, treatment alternatives, fears and myths associated with it, giving proper explanation and reality goals. In educational rehabilitation, we educate about particular condition, what are the prognosis, treatment and alternatives for a particular disease. Remedial education related to vocational services and supportive environment is provided. Encourage the client who have the capabilities to undergo higher education and attainment of vocational skills. Measures are taken to enhance the person's acceptance of his illness. Encourage the client and family members to actively participate in care-related activities and adopt coping strategies to overcome the problem occurring related to disease process and to live more productively within the community. Occupational rehabilitation. In occupational rehabilitation, it will be carried out to achieve job-oriented skills, which is why it is called occupational rehabilitation, and pleasure-seeking activities whereby the client can obtain independent way of living and will try to overcome the problems related to illness. Here comes the role of nurse in psychiatric rehabilitation. So what are the roles a nurse is having in rehabilitation? So rehabilitative psychiatric nursing must be studied in the context of both the patient and social system. This requires the nurse to focus on three elements: the individual, family and community. It means when you are rehabilitating a person, you need to think about a person, you need to think about the family, and you need to think about the community in which a person is going to live. First one is assessment of the individual. The nurse should assess the individual in the areas of symptoms present, motivation, strength, interpersonal skills, self-esteem, activities of daily living and drug compliance. It means a nurse should assess everything about the individual. Assessment of family. Family structure including developmental stage, roles, responsibility, norms and values. When you're assessing a family, you need to see how the family is developing, what are the roles and responsibility family members are having, what kind of norms they are following, what values do they have. Family attitudes towards mentally ill members. Family, how a family is pursuing or how family attitude towards the mentally ill member. Emotional climate of the family. Social support available to the family. Past family experiences with mental health services, and the family understanding of the patient's problem and the plan of care. Assessment of community. It includes assessment of community agencies that provide services to people who have mental illnesses, assessment of attitudes of the people towards the mentally ill, etc. Next, we have assessed the things for individual, for family and for community. Now what we can plan and what we can implement. So planning and implementation in rehabilitative psychiatric nursing focuses on fostering independence by the maximizing personal strength. The nurse and the patient must work together to find ways for the patient to overcome any remaining impaired areas of function. It means we need to apply or we need to plan the strategy that we can actually implement for the person. Individual interventions, again, hospital rehabilitation, inpatient rehabilitation. This involves therapeutic community, recreational therapy, social skill training, and training in basic living skills. In community rehabilitation, providing care in the community settings like homes, residential care settings, foster homes, etc. Then family interventions. Health education to family members regarding the disease process, available resources, communication skills, and problem solving technique. Motivating the family members to provide proper care to the patient. Group therapy and support to the family members through self-help group. Nurses are in a favorable position to help families cope with the stress and adapt to changes in the family structure. Now, what are the community interventions? So, these are several ways that a nurse can intervene in the community tertiary prevention programs. Among this are health education to the public, training to the school teacher, village leaders, and paraprofessionals in the rehabilitation of mentally ill people. Evaluation. So, evaluation of psychiatric rehabilitation service usually take place at the level of impact on the patient, family, and the effectiveness of the community service. Barriers and rehabilitation. There are few barriers, like to find wholesome environment, adequate housing for the client to live comfortably, to identify job resources, and to find out suitable job. Unable to participate actively, occupationally, and socially in the life. The attitude of family members will be affecting the client performance related to instrumental and expressive functions of family. So, this is all about psychiatric rehabilitation. We have seen introduction about psychiatric rehabilitation, then we have seen the definition Maxwell-Jones in 1952 has given. Then we have seen in what are the conditions or in what are the disorders we can give psychiatric rehabilitation. Then we have seen the principles of psychiatric rehabilitation. Then we have seen the approaches. Then rehabilitate, who are the members of rehabilitation team. Then we have seen the steps of rehabilitation team. Then we have seen the types of rehabilitation, which include social, vocational, educational, occupational rehabilitation. Then at last we have seen the role of nurse. In that we have seen the assessment of individual, assessment of the family, and assessment of the community. Then we have seen the planning and implementation. In that individual intervention, we have seen in that hospital rehabilitation, community rehabilitation, and family interventions and community interventions we have seen today. And at last, we have seen the barrier in the rehabilitation. So this was all about the psychiatric rehabilitation for BSc third year students. Thank you.